My name is Keaton Ware, and this is my community health assessment project for Forrest County, Mississippi. I chose Forrest County to explore in this community health assessment project because I was raised here, and this is where I've lived most of my life. The cities located in Forrest County are Hattiesburg and Petal, and the unincorporated communities are East Abuche, Glendale, and Royal Springs. The two images I've included here on this slide. The top image is where Forrest County is located in respect to the other counties in Mississippi, and the bottom left image is the logo of Forrest County. Here I've got some drone footage that kind of flies over the county and explores various aspects of it, so I will play that now. All right, here I have the infrastructure of Forrest County. This picture on this slide is going to be the Hattiesburg Town Hall, which is located in Forrest County. The healthcare systems in this county are going to be Forrest General Hospital and the Hattiesburg Clinic. The educational institutions are the University of Southern Mississippi, William Carey University, and Pearl River Community College. And the military base located in this county is going to be Camp Shelby. The image on the top left is going to be Forrest General Hospital. The middle left image is the Hattiesburg Clinic. And the bottom left image is Camp Shelby Military Base. The top right image is going to be the University of Southern Mississippi campus. The middle right image is going to be William Carey University campus. And the bottom right image is going to be Pearl River Community College campus. So the physical environment of Forrest County is going to be, the majority of it is comprised of pine woods. And the main waterway that runs through this county is going to be Leaf River. As you can see at the bottom left, I have a image of kind of the main waterways in Mississippi. And if you will look at Forrest County, it's going to be Leaf River is the one that runs through it. The social environment of Forrest County, you have the Hattiesburg Zoo, and then you have various music events such as Live at 5, which I have an image here, and then various community arts, Hattiesburg Community Arts Center being one of those. The demographics of this county, the population is 78,110. The median household income is $49,340. The unemployment rate is 3.8%. 22.4% of persons are in poverty. 91.3% of the community members have a high school diploma or higher. And the chronic health issues are going to be 40% of obesity, 19% smoking, and sexually transmitted infections, which is 1,140.3 cases per 100,000 individuals. So some of the community strengths of Forrest County, first is going to be the alcohol impaired driving deaths. Forrest County has an 8% average compared to the national average of 26%, so significantly lower. Mental health care providers, you're going to have 1 per 210 people in Forrest County, whereas the national average is 1 per 320 people. In Forrest County, the rate of primary care physicians is 1 per 1,150 people, compared to the national average of 1 per 1,330 people. Some community weaknesses is going to be the adult obesity rate in Forrest County is 40% compared to the national average of 34%. The adult smoking in Forrest County is 19% compared to the national average of 15%. And the sexually transmitted infections in Forrest County is 1,140.3 cases per 100,000 people compared to the national average of 495.5 cases per 100,000 people. Methodology. Census data and county health rankings were used to collect data for this project. The data sources used were the U.S. Census Bureau and the county health rankings. The U.S. Census Bureau every year publishes population estimates and demographic components of change such as births, deaths, and migration. This data can be sorted by characteristics such as age, race, sex, as well as national, state, and county location. The county health rankings and roadmaps provides local level data that shows how people from one county to another rank on a range of factors that determine health, unemployment, education, community safety, diet and exercise, and other areas to ensure that every community is a healthy place to live, learn, work, and play. The goals of this community health assessment are to address these three areas: reducing levels of obesity, encourage smoking cessation, and lower rates of sexually transmitted infections. Objectives: reducing levels of obesity by providing education relating to healthy eating choices and the benefits of exercise to the residents in this county. In addition to this, information about local farmers markets and walking trails can be disseminated. Encouraging smoking cessation among county residents by providing education relating to the harmful effects of smoking. These individuals can be provided with information about addiction and local addiction treatment centers. To reduce the rates of STIs, information about sexually transmitted infections as well as information about preventing them can be distributed. Local pharmacies could disperse STI preventative devices such as condoms at no cost to residents. All of this information will reach the residents of Forrest County through social media and/or flyers posted at local restaurants or handed out at local events. A website containing this information will also be a resource residents can refer to. Evaluation. Survey. County residents will complete surveys to see if they have made any behavioral modifications related to these three goals. Further education. The surveys will also gauge how each county member feels in regards to their knowledge level about these goals. This will allow for a specific area to be addressed if there is a knowledge deficit. Assessing data trends. The trends in each of these three areas will be monitored each year. If there is no change or an increase in one or more areas, those areas would require further addressing. Here are my references.